Good day, my gorgeous goblins. Welcome back to another episode of MB2 Underground. If you don't know, now you know. I'm Sarah Kiefer.
And I'm Joe Fox. What's happening, Miss Kiefer?
Not a whole lot. I am really excited for today. I know you always get to say that, but I'm excited for today because we're interviewing the first doctor we partnered with post-COVID.
Yeah, that's a big deal.
Yeah, and that was a crazy time.
Unique time. Yeah, the craziest.
Getting on a plane in July of 2020, I thought was definitely how I died.
Wow. Well, back me up a little bit. How was Scotland?
Really good. The best part about Scotland is the accents on the little children.
Oh my gosh.
Like I was in the bathroom at the airport and this little girl was like, "Mom, I've got to wash me hands."
And they're so polite, right?
And they're so cute. I was like, I need somebody to raise my child in Scotland and then bring them back when they're fully like fleshed out.
Exactly, like 10, 12 or so.
Yeah, it was pretty dope.
Did you throw any rocks or logs or any of that stuff?
Was I supposed to?
I mean, I think that's what they do over there.
I drank a lot of whiskey.
Nice.
That was really the goal.
Went in Scotland, be Scottish.
Yes.
Awesome. You know what Mike Myers says about Scottish stuff, right?
No.
Yeah, I got an SNL fan here.
I've never SNL'd before.
That's a bummer.
Yeah.
If it's not Scottish, it's crap. You never. I guarantee you, your hot boyfriend knows that quote. Did he get a kilt, by the way?
Hot?
Yeah, hot boyfriend. I saw the pictures. I was following you.
You were. You're not very active on social media either.
Now, when you go on a trip, I follow you. So
oh my
there
gosh.
you go. I got all your pictures.
So
I love it. It's beautiful. So yes, I am also excited about our guest. This person has a great business, great clinician.
A couple of great businesses.
Yeah, and exactly, and has a unique kind of passion, clinical passion, which is special. But also on top of all that, this person is a professional podcaster.
Well, I know.
He's going to teach us about how to do this and get more than 3 followers. So,
hey, do they follow? Oh,
I don't know.
They subscribe. They don't follow.
Agreed. Yeah, but yeah,
they don't do that either.
Yeah, tomato. Sorry. So I'm very excited. Well, so without further ado, I would like to introduce the pride of the Show Me State.
Show Me State?
The Show Me State, Missouri. Come on.
Okay, sorry. Go ahead.
Imperial, Missouri, outside of St. Louis. Dr. Stacy Becker, welcome.
Thank you so much.
It is so good to see you again.
It's good to see you again.
How have things been
here.
since 2020?
Oh, it's been a ride. It's been a ride.
Well,
it has been a ride.
Before we get into that too much, we came prepared with a fun opening game.
Oh my goodness.
If you're ready.
I am as ready as it's going to get.
Well, I hope it's going to be fun. If it's not fun, we just won't know.
Okay, we just, edit it out if it's bad.
Right. Just like edit it out. That's all you got to do. Okay, we're going to do this or that. So I've been lucky enough to work with you. Joe hasn't. And so in my mind, this is going to be how he gets to know you before we get started.
Okay. Yeah.
So rapid fire. Don't cheat. Are you ready?
Yeah.
Okay, coffee or tea?
Coffee.
Yeah. Black or like creamer and
black?
Yes, my girl.
Man,
okay.
I like you even more.
See, this is the goal. Okay, if you were going to go on a vacation, beach or mountains?
Mountains.
Okay, I'll give you about 50% on that.
Okay.
Early bird, night owl?
Early bird.
Yeah, okay. Books or movies? Or TV shows?
Audiobooks.
Oh, I like it.
Nice.
Podcasts.
I
tried to wing
it. Podcast.
Sweet or savory?
Savory.
Okay. So like if you were going to have like a treat while you're listening to your audiobook, you're going to go like chips over candy.
Yes. Chips and salsa.
Nice.
Oh, yum. Okay, cats or dogs?
Dogs.
Okay. Summer or winter? Or fall or spring?
Fall.
Yeah.
Fall.
We don't really have that here.
Oh,
But
we have a great fall in Missouri.
I bet.
Beautiful.
yeah, I feel like we're missing out on something.
Yeah, you are.
Okay. Dinner at home or dinner out?
Home.
Now, are you cooking or are you door dashing?
I'm door dashing.
As a girl.
Great
You're like,
follow-up.
I don't.
I'm door
That
dashing.
wasn't even scripted.
No, it wasn't.
I'm proud of you, Miss Kiefer.
You did that on
Thank
your,
you.
Yeah.
Well, because I was thinking I'd rather be at home, but I'm not going to cook.
I'm not cooking.
What do I look
mean,
like?
Yeah, not anymore. I have hardly any kids at home now, so I'm like, yeah, I'll DoorDash.
Yeah, you're like, that's the first step into empty nesting.
It is.
Not
It
having
is.
to cook anymore. Okay, road trip or air travel?
Road trip.
Okay. Yoga or weightlifting?
Yoga.
Okay. Podcasts or audiobooks?
Podcast.
I know, I kind of like
Yeah.
skipped ahead on that one. Okay, Netflix or Hulu? Or alternative streaming service? Are we allowed to say brand names on this?
No.
Do you think they're going to sue us?
I think I'm going with Netflix. I don't know. I do both. Hard to say. You stumped me.
Thank you. I worked really hard on these. Okay, concerts or sport events?
Concerts.
Okay, last. As a traveler, are you somebody with an itinerary or are you more spontaneous?
I'm spontaneous.
Really? That's
Really?
surprising to me about
It
you.
is. When I go on trips, I just want to wake up and say, what are we going to do today?
And then you don't leave feeling like, oh, we didn't do the things that we probably should have because I didn't plan it out.
No, not at all.
Oh my God, I'm getting
planning
hives.
it makes me nervous. Planning makes me have hives.
Oh my gosh.
It makes it work, right?
It
It's not
makes
vacation.
work.
Yeah.
I just want to. Now, if someone else plans it and then they say, hey, this is what we're doing,
Go
I'm like,
here.
okay. Yeah. Yeah.
Okay.
I'm good.
I feel like we know you really well
Yeah,
now.
do.
that's it.
Can I ask one more get to know you question?
I thought you didn't want to do them.
You got to tell us. Well, this is kind of off script.
Okay.
You got to tell us about playing dentist when you're 4 years old. How did this start? How did you
geez.
have?
Yeah.
I've got to understand because that's a pretty special story.
It is, and it's funny because I didn't know that most people don't know what they want to do when they're 4.
I did.
thought,
I was going to be a ballerina astronaut. Ask
And
my
here you
caricature.
are.
You still got
And
time,
here
my
you
friend. Get after it, girl.
I was 4. I knew I wanted to be a dentist. I had a great dentist, but I was already conflicted at 4 because I knew I wanted to be a mom. I knew I wanted kids, but I also wanted to be a dentist. So
I feel like I'm 32 and I don't even have those like types of conflicts yet. Motherhood or career? Which one?
Career, motherhood at
4
4.
years
These
old.
were things in my 4-year-old mind.
Wow.
And my dentist hired a female associate, Dr. Carolyn Wolf. I'll never forget her.
Wow.
And she told me in the chair one day, I hear you want to be a dentist. I said, I do, but I want to be a mom, so I can't.
Oh, wow.
And so she said, after my appointment, she said, come here. I want to show you something. She took me in her office, and on her desk were pictures of her family.
Oh.
And she said, you can be a dentist and a mommy and a wife. And I was like, it was just mind blowing to me because I always had my male dentist that
Yeah.
So that was it. I was excited. And so my brother was my first patient, and I would sit him down. Either the toilet was the office was, my little office was my little powder room at the house. And he would sit on the toilet, and that was my operatory. Or he would lay on my bed. I would put a sled down, and he would lay on the sled, and I'd put aluminum foil on his teeth and say braces.
Oh my gosh.
Yeah, I pull all my cousins' teeth.
Wow.
They would line up.
Okay.
Yeah.
When you say you pulled their teeth,
They
did
were ready
know
to
you
come
were
out.
Okay.
And I told them
I don't know why I just pictured
they
you
need
like
to come
sneaking
out.
into their bedroom.
No.
Like,
But that is a superpower, right? I mean, I've got 5 kids, and the deal with all this, hey, we need to pull it. No, daddy, no, don't touch me.
Oh, yeah.
You're convincing people at 4 or
Convince
5
them
years old.
I'm the one. You
That's a
need
big
to
deal.
let me get that tooth out for you. It
Wow.
drove. Yeah.
What a cool story.
Yeah.
right?
It just was interesting. It was I was put on my heart. What are you guys laughing at?
There's always something.
I can't. Okay.
This is part of our
Yeah, it is.
podcast. We're just winging it here.
I know you have to
So I
tell me
I
later.
apologize for
No,
my.
I love it.
So
yeah, that was put on my heart.
does that dentist know how much of a role she played in how your life turned out?
It's funny because I've thought about it. I mean, over the years, I really should reach out to her. The main dentist, when I became a dentist, he sent me flowers the day I opened my practice. I thought it was so sweet. Because he was so influential in my life.
That's so cool.
But I don't know what happened to her. So now
Dr.
that
Wolf,
we're
we're gonna have to look her up.
Carolyn Wolf in St. Louis, I'm going to have to look her up when I get home and
That's super cool.
maybe send her this.
Yeah, be like,
Hey,
shout
by
out.
the way,
Plug. Well, I remember during 2020, you're talking a little bit about your aspirations in motherhood and in dentistry. And that was back when during integration, we would do an interview, okay, how's it going? How are you feeling? And I remember you feeling really good about being able to feel like you were doing both completely, because as a business owner, it's taking up a lot of time. You've got 1,000 kids just like Joe does. So you're trying to manage and balance both of them. How has that changed over the last few years?
I mean, it really has changed. I mean, that was the whole goal. Please give me some balance in my life because it is overwhelming to own your own business. Yeah. I mean, it's blood, sweat, tears, more tears. You're just not fully present because you're always thinking about something. So I've been able to let go of a lot and really be more present. And it's funny because people don't tell you. I don't know what your kids' ages are.
All of
But
them, all of the ages.
all the ages. They span all the ages. But mine were hitting like high school, and now I have 2 in college officially and another in high school. I mean, it's crazy. And nobody tells you they need you so much. It's not just your I mean, you have to be like listening.
Yeah.
And you have to be present. It's not just I'm physically around
Or I'm just keeping
to
you
keep you
alive.
from dying.
Yeah.
Yes. And eating something weird or,
Yeah.
Mommy, look at this picture. Oh, it's great. You have to be like listening, paying attention, and they call you out.
Yeah.
The game changes. Yeah, it gets harder.
Yeah, it gets
I didn't
harder.
understand that. My
Yeah.
wife always knew that.
Nobody tells you that part.
No,
Well,
not
along
at all.
with opening up free time for, your family, you also, and I remember this as well, your passion project has taken up a lot of your time too. You've been able
Yes.
to dedicate more to that.
Yeah.
Tell us a little bit about that.
So, probably 20 years ago, so it's weird to even say that out loud, but 20 years ago, I got into dental sleep medicine, adult dental sleep medicine, because of my dad. So, he couldn't tolerate a CPAP. So, the sleep physicians came to me. They're like, you've got to do something for your dad. And I am very analytical. It's like all or nothing, analysis paralysis. So, you didn't learn much about, and you still don't learn much about this in dental school. And hopefully that's changing because we have such an influential role in sleep and a place at the table to help so many people. But over the years, as I had kids, I realized there's really nothing for children in the dental arena. So my own kids were suffering from upper airway resistance and sleep apnea, snoring, things like that. So I started on a quest of figuring out what I can do to help my own kids. And then I realized there's nothing out there for dentists, really. I mean, you have to just be out there all on your own, navigating the Wild West. And I met 2 other dentists that are just like me with this passion. And so we co-founded ASAP Pathway, which is ASAP, as soon as possible, but also an acronym for airway, sleep, and pediatric pathway. So we started, like, what if we put together all the knowledge between the 3 of us that we wish we had 5 years ago? So I've been able to really focus on that more. And I think most people that are dentists that own their practice, you're just entrepreneurial.
Yeah.
There is something about you that's entrepreneurial. So my
Probably
daughter,
a little ADHD, but yeah.
100%. I'm undiagnosed ADHD. So funny you say that too. But my daughter said, Mom, when you partnered with MB2, that's great and all, but I know you're going to fill it with something else. And I did.
Sure enough.
So sure enough, I filled it with something else. But I've been able to focus on that and the passion of that. And it's been so rewarding and meeting so many people. And
That's so cool.
yeah.
So I listened to great podcasts, by the way.
Oh,
right?
thank
For folks,
you.
for folks that want to check you out. Literally, it's ASAP Pathway podcast, correct?
Yes.
Yeah. I got on YouTube. So I listened to episode 31. Doctors Gunson and Bacow.
Yes, that was our
That
most
was really
recent.
fantastic. It was
Oh,
fascinating.
thanks.
And
I feel like I didn't do my homework. I'm so sorry. I'll
Oh,
listen
thanks,
after this.
Sarah. Thanks for.
but I, so
Overachiever.
Again, I've heard about sleep, right? I'm in the dental business, but I haven't really heard about like sleep focused on kiddos, right?
Right.
And so again, having a few kiddos, like that kind of really piqued my interest. And like, so a few questions, right? But first and foremost, like, what are parents to do, or what should they be looking out for? And I think you just maybe gave me the answer a few minutes ago. Should we creep on them? Are they snoring?
You should
at
creep on
night?
them.
Yeah.
And really a lot of parents, when I even in the dental treatment room, that's where the discussion starts. Because you'll see signs, we as dentists can see signs that our physician colleagues aren't going to pick up on.
Yeah.
They're not trained.
Yep.
The average physician and dentist get maybe 1 or 2 hours of sleep education in medical and dental school.
Wow.
Yeah.
And
Jinx.
it's something we do,
It's a third of our
8-ish.
life.
Yeah, exactly.
So if you live to be 90, you should have slept for 30 years.
Unreal.
So,
Whoa.
yeah.
Hold on. That's a lot.
Yeah. And
Why do I
that's
feel
an
like I need
important
more
part of
sleep?
your life. You need good sleep.
Yeah.
More sleep, quality sleep. But back to what you were saying about what we can identify as dentists, as parents, a child should be getting a lot of sleep, quality sleep, non-fragmented sleep. They shouldn't be getting up and down.
Right.
The covers shouldn't be all over the place. They shouldn't be in weird positions. They should not be snoring. They shouldn't be mouth breathing. They should be breathing through their nose. The mouth has 0 physiological aspects for breathing. 0. And so many kids are walking around breathing through the wrong hole. Wow.
I heard about that even like as an adult, that when you learn how to take deep breaths, it's in through the nose, out through the mouth. And they're like, you should be going in and out through the nose.
All the way.
And that was a game changer. I did competitive sports growing up, and everybody told me to do it completely different.
Right. And they even say that in some like meditative breathing exercises, in through the nose, out through the mouth, and it's in through the nose, out through the nose. There are some competitive, athletes that mouth tape while they run marathons.
And they don't die.
No, and they don't die. I'm not there yet, but I mean,
jeez. Right.
Yeah. So mouth breathing is a sign of an unhealthy human. If you breathe through your mouth, you're not filtering, humidifying, zapping all the bugs. You're not there. Actually, you breathe through one nostril at a time. So it's such a tiny little, there's a reason you should be breathing through a little tiny hole. There's dynamics involved with that as well. So yeah,
that's so interesting.
You should not. There was a study, the Karen Bonnick study a few years ago, studied like 11,000 children. And they never had a sleep study, but they either snored or were mouth breathing. They had some kind of problem. And from that study, they studied from like 2 years old to 7 years old. There was such a huge correlation with neurocognitive deficits and behavior problems that one study from Karen Bonnick of those 11,000 kids, it went straight to the, American Academy of Pediatrics. And it's like, we need to have a 0 tolerance for snoring.
That's insane.
Yeah.
The mouth is for breathing, the nose the mouth is for eating.
Eating.
The nose is for breathing.
And I'll say to kids, I'll ask kids, do you breathe through here or do you breathe through here? And they'll sit there and I can tell they're mouth breathing, like their lips are apart, chapped lips, chronically chapped lips. And they'll point to their mouth and it's like, so if you had an ice cream, would you put it up your nose or would you put it in your mouth? And they're like, in my mouth.
Well, I don't know.
I mean, maybe, Sarah, we might. But, it's like just logically thinking about it. You're like, yeah, you're right. I wouldn't put what is my nose for? If I'm not breathing through it, what the heck is it there for?
Right.
Yeah.
You can't smell. You can't breathe. There's so much happening in the nose. Nitric oxide production. It's just...
There's a nervous system, right? Ramification as well.
Yes,
right?
autonomic nervous system. Like they've even done studies. There was an ENT I listened to years ago, and it was really fascinating. He talked about one side of the nose correlating to one part of the brain, the other side correlating to the other. So one was more parasympathetic to calm you down, and the other side of the nose will help with sympathetic tone. So if you want to calm yourself, and I have to remember which side is which. I have to look it up, but one side was parasympathetic. Do you know?
I have a little bit of a yoga background.
Okay,
the
so you
the yogis have been
do.
talking about this for years. It's
They
called
have.
alternate nostril breathing.
Yes.
Right? It's right nostril, left hemisphere,
Yes.
left nostril, right
We got that on
Yes,
video,
and
right?
Yeah, we'll get that.
Well,
Yeah,
and
anyway.
breathing,
Fascinating.
I don't know as much as Joe, but from what I've heard, breathing is like the only part of your nervous system you can actively control.
Yes,
Because you
yeah.
can actually like change it. Everything else is kind of what's happening on the
Oh,
inside.
you can downregulate your nervous system beautifully with breathing. It's so underestimated. It's so underdiscussed. Breathing.
Yeah.
I mean, it's pretty important. We
Yeah.
can't go very long without it, and it's not talked about.
Yeah.
Yeah,
It's just
conscious breathing. Is
Conscious
special.
breathing.
It's becoming. There's a lot more
it
awareness.
is. The awareness is changing. I mean, yoga, like you said, breath work. Thank goodness that is starting to be more discussed because it's leading into what I do and what sleep physicians are doing and how important it is. I mean, you can change lives. Yes, it's wonderful when you change your adult patient's life and they come in with such gratitude. But the reality is I can sit there and tell an adult, you're choking all night long. Your high blood pressure, your acid reflux, your anxiety medication, your all of this, you have flags on your health history that are leading to poor sleep, poor breathing. And they'll go, yeah. they aren't as eager to change. They're kind of like, some of them are like, oh my gosh, thank you. Let me get on my health.
Yeah.
And they have such gratitude. But when you tell a parent that their child is struggling and that it is literally changing the trajectory of their child's education, behavior, neurocognitive development, they're on it.
Absolutely.
They're on it because they care more about their kids than they do
Right.
themselves. So
That's what I think is so cool about sleep is I don't know anybody who has an interest in sleep medicine that does it for the money or because they fell into it. It's very much a passion that people
It
have. And it
is.
usually comes from something like you said with your father who had some issues and then seeing it in your kids, like being able to solve a problem and be able to see the before and the after so clearly, I think really gets people excited.
it does. We actually, once a month with our ASAP members, we have like case reviews or we have an expert on just to have discussions. And Tuesday night, we had case reviews. And it's so interesting how many of our members jump on their first case as their kid. And that's why, like
Yeah.
you said, it's, you get into it because it's someone you love, it's someone you know,
Right.
and it is a passion. And can you make money in your business? Well, yes, you can. And you should, because if you can't be productive and
Right.
successful in the business, then you can't help people. But that's not why people do it. So it's like usually it's dentists are taking a passionate project and wanting to make it profitable.
Right.
But it starts with the passion. It doesn't start with, hey, I want to make some extra money. Let's get into sleep.
absolutely.
Right.
That is not the case. You're so right.
So one of the other interesting components that I picked up, or tidbits I picked up on the ASAP Pathway episode 31 was the collaboration between dentistry and the rest of the medical community. And I guess maybe the lack of
Yes, the
collaboration.
lack.
Tell us about that. That was like kind of
It goes
like,
both ways too. It's dentists are not taught in dental school how to communicate well with our physician colleagues. And then our physician colleagues aren't taught how to step out of their paradigm
Right.
and refer to a dentist. So everybody's nervous. Everybody's like,
Why?
how do we do this? It has to change. The culture has to change. If you go back 100 years, dentistry and medicine were hand in hand.
Interesting.
We didn't separate it. But our physician, we actually know a lot more about what our physicians are doing than the physicians know about oral health.
Yeah.
So we have to reach out because they're missing the oral health piece. We're not missing the overall piece. We had to learn all of that before dental school and in dental school, but they aren't taught that oral component. It's compartmentalized.
Yeah.
It's removed. So it's really on us to step out of our comfort zone and reach out, write letters, send a flash drive. Is that a thing anymore? Do people send flash drives? Am I dating myself?
What is a flash drive?
Hold on
come
a
I've got
second.
like
I'm just
3
kidding.
in my
Yeah, thank you.
briefcase.
Okay,
Yes.
I'm like, is there a new way to do it? Send them a Google Drive, send them something showing the research, how we can collaborate. And once they see that, they're eager. Usually the ones that you want to work with are eager to work with you. But yeah, there needs to be more collaboration. We need to be talking with an ENT. I mean, if you have a CBCT as a dentist, you are seeing so much of that. You're seeing everything.
Yeah.
I'm seeing sinusitis. I'm seeing adenoids. I'm seeing turbinates. I'm seeing
The turbinates?
The turbinates.
I don't know what that is. There's just a really cool
I'm
word.
sure there's a conference room with that name here. That's
Hey, that should
That's
be
our
on the
conference
list.
room.
It should be. If it's not, it should be.
Yes.
wow.
Deviated septums, all of that. So it's like, wow, you can like
Yeah.
punt to an ENT, and then that ENT is like, who's your dentist?
Yeah.
Like, what are they doing? I need to be working with this dentist.
It's a little
So, yeah.
scary to think about the fragmentation of,
Oh, it is.
healthcare because a lot of people rely heavily on their healthcare provider. And if that person's not educated enough to know what the next step should be, they're kind of SOL.
Yeah.
So have you made relationships with ENTs locally?
Very
or-
much. Orthodontists, that's the other thing too. Orthodontists have such a, especially with interceptive orthopedics, moving the bone, helping change that craniofacial aspect, changing the way a child breathes. That is changing as well. So orthodontics has it on the radar now. It's not been discussed. So even within dentistry, working with the oral surgeon, identifying who could benefit from surgeries like MMA surgery or TMJ reconstruction replacement, our orthodontic colleagues. But yes, ENTs, sleep physicians, myofunctional therapists, gastric specialists for weight loss. You really should be collaborating with pretty much all of medicine.
Right.
Because you're
Whole
working on
network
a
of
human.
physicians.
Yeah.
totally.
And
The
it's
entire
like the
human.
entire human. So when you're reviewing that health history,
I love it. It's so cool to look back 4 years and see how far you've come in your sleep business and what you've been focusing on there. What advice would you have to, dentists, younger dentists that are trying to balance clinical practice with their entrepreneurship? Say it for
She
me.
hates that word.
Entrepreneurial.
I hate that word too. I'm so glad.
Somebody else say it.
I'm
It's
not
French.
going to
What,
say
works in
it.
France too or something? Oui, oui.
You said it excellent.
Thank
I
you.
think. I think for a young dentist, if I could go back and talk to my, 28-year-old self at 50, I would have said, and it's different now. So when I got out, it was private practice.
Mm-hmm.
That was it. You
Through
did
and
private
through.
practice, and you either were an associate or you did that, and you jumped off the diving board into ownership, and that's what I did. There are different avenues now. Obviously, this is an MB2 podcast, so
What?
DPOs
just kidding.
have changed everything.
Yeah.
What's funny is my associate never has had it on her radar to own by herself.
Interesting.
It's very different right now
Yeah, that
because
is
of the
interesting.
options they have with DPOs
Yeah.
and ownership, but having support.
Wait,
But
I love that.
It is. And she said her whole class, very few wanted to own their own by themselves. Sounded horrible. I'm like, well, it was.
It was.
So
And you're welcome.
confirm.
it really was, and you're welcome. But being intentional and do not apologize or feel bad or guilty or like you're less than as a doctor because you prioritize your family. Say no more. I said yes to everything because I felt I had to. That's just what you did.
Yep.
Yeah, just be more intentional and guarded of your personal life and your sanity and your
Energy and time.
Mhm.
Yeah, I love
and your
that.
time, because everyone will line up when you're getting out with of school with you need to be doing this, you need to be doing that,
Yeah.
and you feel. Dental school it did not do a good job with our self-esteem when we got out. We were ready to be dentists, kind of, you know enough not to, kill someone. And then you really learn when you get out, but nobody, the self-esteem wasn't there,
Yeah.
because they break you down and then no one built you back up. So I think just connecting with colleagues, don't be an island. Protect your family, protect your personal time and your hobbies and your interests and your joy.
I love it. I think that's great advice.
Awesome. What's the next topic for the ASAP podcast?
So I have Dr. Sarush Zaghi coming on soon. He is an ENT out of California, and he is amazing.
That's awesome.
Doing amazing things. He's from the Breathe Institute, so that'll be a fun
That's
podcast.
cool. I didn't know that was a thing.
And a lot of things. Go back and listen into 30 also, because I interviewed Dr. Audrey Yoon. She's from Stanford, and she's the first. She implemented sleep medicine within orthodontics. She's the first one in the nation to do that.
That's sick.
So they're learning sleep within orthodontics and the impact they can have. So many exciting things are happening in sleep. It's a good time to be a dentist.
Yeah.
It really is.
I love it.
Well, honestly, that podcast kind of lit a fire under my butt. My
yay.
13-year-old needs braces, and my wife comes home and says, Dennis says Tiago needs braces. I'm like, oh, okay, we'll put that off. But really, I don't want him to have to go see Dr. Gunson, right? To have some intervention when he's 20.
Right. When the growth is done,
Yep. Totally.
then you're looking at surgery.
Yeah.
Absolutely.
I'm sure I'll hang on to all this if I have kids one day and
You
remember it.
You will with that hot boyfriend. Dr. Becker, thank you for being here.
Thank
I really
you.
appreciate it.
Thanks for having
Yeah,
me. It
thanks for
means a
coming back
lot. I
in.
appreciate it very much. Thanks for having me. Really.
Appreciate it.
Thanks for being here. Awesome. Listeners, thank you for joining us for another great episode of the MB2 Underground podcast. We will catch you next time.
Keep breathing.